Defund the police. Those words, you've heard them and seen them written in the road outside police headquarters last month as thousands of people rallied in support of scaling back the $1.22 billion police budget here in Toronto. Their calls were denied. City Council voted down a motion to cut the police budget by 10% a few weeks ago. One of the common counter-arguments that we have heard from councillors, defunding is not the answer. Instead, we need to focus on changing how existing programs are run here in Toronto. But what does that look like? Joining me now with more is City News reporter Faiza Amin. Faiza, you've been looking into this police program that a lot of people have heard about, but not a lot of people know how it works. Good morning to you.
Good morning, Mel. How are you? It's called the Mobile Crisis Intervention Team, and they're part of Toronto Police. So this is a collaborative initiative between Toronto Police as well as Toronto area hospitals. And what happens is you have specialty police officers teamed up with trained mental health nurses. Together, they are deployed to areas where someone is perhaps having a mental health crisis, and they have a number of roles to occupy there, whether it's to de-escalate a situation. In some cases, they are stopping that individual from harming themselves or harming someone else. And they're also there to connect this individual to other mental health resources in that community. The purpose of this is to ensure that this person doesn't necessarily go through the justice system or to an emergency room if not completely necessary. So there are 16 Toronto police officers currently on this team and about 35 to 40 nurses occupying a number of roles. Together, they respond to about over 6,000 calls a year. So that's about 600 calls annually per team.
Faiza, I think a lot of people have the question about, we've seen the headlines about these response teams and whether or not they are effective, whether more funding needs to be put toward them, how they are even deployed. Let's talk first about hours of operation. Number one, are they always going 24/7?
The short answer to that is no, and the members of the public can directly call the MCIT team. What happens is you would have to contact either the non-emergency Toronto Police line or 911 and say that you yourself or someone else is currently going through a crisis. That's when the team is deployed. So they do work 7 days a week. However, the hours of operation tend to be between 11 a.m. to 11 p.m. So that's one of the criticisms, because people do go into crisis outside of these hours. And so Toronto Police actually gets about 30,000 mental health related calls annually, but this team does not respond to every single one of these calls for a variety of reasons. For one, there has to be a number of different thresholds met. One of the calls they don't take is if the individual perhaps has a weapon on them, if the person on the phone says that the individual has a weapon on them, and so they do not attend those calls. And so that's concerning for a number of people, community members, as you mentioned earlier, calling on defunding the police and taking that money and putting it back into the community where mental health services can perhaps be provided by those experts. So tonight at 5 and 6, we're going to be speaking to this team about these concerns, ask them why they're not attending all these calls, whether it's something having to do with not having enough resources, not having enough money, and whether or not Toronto Police are best equipped to lead this conversation.
That'll be very interesting, Faiza. Thank you so much for that report. We'll be tuning in tonight.